Okay, good day nurses. For today, let us discuss pneumothorax. Okay, by definition, pneumothorax is the collapsing of the lung due to air accumulating in the pleural space. So sa madaling sabi guys, is nag-collapse ang isang lung natin dahil merong accumulation of air inside the pleural space. Okay, for us to understand it, the definition of pneumothorax, let us discuss the brief anatomy of the lung. Okay, we have here the right and left lung. The one that is attached to our chest wall is called the parietal pleura, and the one that is attached to our lungs is called the visceral pleura. Okay? Between the visceral and parietal pleura, merong space dyan. Ang tawag dyan sa space is the intrapleural space, and that contains a pleural fluid. Okay? A serous pleural fluid, okay, that serve as a lubrication para hindi masakit when we inhale and exhale. And our intrapleural space, guys, it contains negative pressure. Ang negative pressure na yan, guys, is that keeps our lungs inflated. So kung nasira or na-disrupt yung negative pressure, anong mangyayari sa lung natin? Magko-collapse like this one, okay? That is pneumothorax, okay? Now, pneumothorax can be partial or total collapse, okay? It can be a partial or total collapse of a one lung. So, isang lung lang ang affected, okay? It is diagnosed with a chest x-ray, ultrasound, or a CT scan, okay? Moving on to the types of pneumothorax, okay? Number one, we have here open pneumothorax. So, from the word itself, open, meaning there is an opening in the chest wall, okay? It can be through a gunshot wound or stabbing. So, sa madaling sabi, magkakaroon ka ng open pneumothorax kapag merong penetrating injury or penetrating trauma, okay? Na magkakos ng exchange ng outside air or the atmospheric air papasok sa ating lungs, dun sa nabutas, dun sa butas, dun sa open pneumothorax, okay? Then the escape of the air in the pleural space, okay? Na kapag nag-inhale and exhale tayo, ang maririnig natin doon ay suckling sound, also known as sucking chest wound, okay? Now, kapag meron kang patient na mayroong open pneumothorax, ito ang pinakamahalaga mong gagawin as a nurse. You need to place a sterile occlusive dressing over the opening and tape it on three sides like this one, guys, okay? Cover the site with a sterile dressing and tape it on three sides, okay? Sa pamamagitan nito, the air can escape, okay? If you tape on four sides, you might cause tension pneumothorax, okay? Tatlo lang, guys, para kapag nag-inhale tayo, okay? When we inhale, ganun, okay, when we inhale, okay, magko-close to, okay, magko-close siya, then when we exhale, lalabas naman yung air, dyan sa open dito, okay? Para hindi mabuo, or hindi mag-accumulate palalo yung air inside the lungs, causing tension pneumothorax. And that tension pneumothorax, guys, is a medical emergency. That's why we tape lang on three side, okay? Para the air cannot enter when we inhale kasi magko-close yan, but the air can escape when we exhale, okay? That's for open pneumothorax. So kung may open pneumothorax tayo, syempre meron tayong closed pneumothorax, okay? For the closed pneumothorax, when air leaks into the intrapleural space without any outside wound. So, ibig sabihin, intact pa rin ang skin integrity natin. So, anong cause? Bakit tayo magkakaroon ng closed pneumothorax? Kapag may blunt trauma tayo or blunt injury. For example, meron tayong rib fracture, okay? Yung rib fracture natin, di ba? Pwedeng yung the matulis na part ng bone natin, ma-penetrate niya yung lungs, okay? When we have rib fracture, pag na-penetrate niya yun, the air will escape into the pleural space, okay? Another example, under closed pneumothorax is the spontaneous pneumothorax, okay? Pag sinabi naman natin spontaneous pneumothorax, it is a defect in the alveolar wall and visceral pleura kapag nagkaroon daw tayo ng formation of pulmonary bleb. This pulmonary bleb is a sac-like blister, okay? Na pwedeng pumutok anytime, okay? Kapag pumutok yan, the air will escape in the pleural space, okay? Bakit tayo magkakaroon ng pulmonary bleb, okay? Kapag during prolonged deep inhalation or prolonged deep breath. Okay, for example, nagva-vape ka, okay, di ba? sobrang prolong. Okay, yung breath pag inhale natin, okay, or naninigarilyo tayo, that's that time prolong yung deep breathing natin. Okay, then we have types of spontaneous pneumothorax. We have the primary and secondary spontaneous pneumothorax. Under the primary spontaneous pneumothorax, it occurs in people without lung disease. Usually, nagkakaroon nito mga lalaki na matatangkad, bata. Okay? And when we say secondary spontaneous pneumothorax naman, occurs in people with lung disease. For example, sila ay may COPD, asthma, and cystic fibrosis. Okay? And lastly, we have tension pneumothorax, okay? So, dahil nasabi natin kanina, si tension pneumothorax ay isang medical emergency because it is a complication of pneumothorax. Complication siya ng open and closed pneumothorax, okay? Ang nangyayari naman dito sa tension, from the word itself, tension, the air collects into the space but cannot escape. Okay, mabubuo yung tension dun, mabubuo yung pressure. Okay, pag nabuo yung pressure dun, pwede niyang makompress yung lungs and heart natin and magkakaroon siya ng mediastinum shift or mediastinal shifting. Okay, then increase din dito ang intrathoracic pressure kasi nga, di ba, nag-accumulate yung air doon. Okay, affecting the unaffected side. Okay? Then, decrease ang venous return. Dahil sa sobrang taas ng pressure dito, guys, lahat ng other organs like the lungs, esophagus, the trachea, the heart can be compressed due to the high pressure accumulating here. Okay? Ipupush niya yan into the unaffected side. Ang tawag dun, mediastinal shifting. Okay? And the late sign for your tension pneumothorax is tracheal division. Yung trachea mo, pumunta na siya sa unaffected side. Okay? Magiging absent na rin ang breath sound dito and magiging hyperresonance ang sound dito during percussion. Okay? Mako-compress niya pa yung vena cava natin, okay? Thus, decreasing venous return. Pag na-compress din yung vena cava natin, kukunti na lang ang dadaloy na dugo papunta sa ating heart, okay? Thus, decreasing cardiac output. Okay, ganun kalala si tension pneumothorax. That's why it is a medical emergency, okay? Now, what are our assessment findings? Okay? Si patient, magkakaroon siya ng sudden, sharp pruritic chest pain kasi nga nasira yung, tawag dito, yung space doon, yung intrapleural space. Okay? Sa intrapleural space, anong meron dyan? The fluid that serve as a lubrication. Dahil wala na yan, okay, masakit na during inhalation and expiration because the parietal and visceral pleura will rub against each other, okay? Dyspnea, difficulty breathing, and takip niya, a compensatory mechanism of our body kasi nga na-compress yung heart natin, the major organs, nako-compress niya, okay? Decrease or absent breath sound on the affected side, gaya ng sabi ko kanina, kasi nag-collapse na yung lungs doon, okay? Then, hyperresonance when percussion. Kasi nga, madaming nag-accumulate na air. Diba? The normal is resonance. Dahil madaming nag-accumulate na air, it can lead to hyperresonance. Okay, yung hyperresonance is a drum-like sound. Diba? Yung drum puno ng air. Kaya when you percuss, okay, hyperresonance ang maririnig. Then, for tension pneumothorax, guys, ano nang sabi ko kanina, the late sign is the tracheal division away from the affected side. Ano pa? Jugular vein distension kasi nako-compress niya yung mga major vessels and hypotension. Compresses the vena cava. Okay, na-compress niya pa yung heart. Okay, thus leading to decreased BP, decreased cardiac output. Okay, for clients with pneumothorax from chest trauma, assess for the presence of paradoxical chest movement or the frail chest. Now, we will discuss on a separate video lecture. Okay? For emergency management ng tension pneumothorax, prepare a needle decompression followed by a chest tube insertion. Okay, yung needle decompression, guys, dito naman, ini-insert nila yung needle, okay, into the intrapleural space, okay, para matanggal kaagad yung air. Pero ang gumagawa nito si physician, si doctor, okay, followed by a chest tube insertion na na-discuss ko on a separate video lecture to quickly remove the trapped air from the pleural space. And for open pneumothorax naman, guys, yung sabi ko kanina, to apply a sterile gauze, okay, that is tape on 3 sides. This create a one-way valve that allows air to escape but not enter. When we inhale, di ba, magto-close yun, so walang makaka-enter na air. But when we exhale, okay, doon lalabas sa hindi na tip na side yung air para hindi siya mabuo doon, causing tension pneumothorax. Okay? For our intervention, we need to raise the head of the bed to promote lung expansion. Okay? We administer supplemental oxygen as needed for hypoxia. Prepare for chest tube insertion to re-expand the collapsed lung. Okay? Sabi ko nga, on a separate video lecture. Okay? To be discussed comprehensively. Okay? Encourage deep breathing and incentive spirometry to help re-expand the lungs, and administer analgesic for pain, okay, to facilitate deep breathing and coughing exercises para hindi siya masakit, okay. Then monitor respiratory status frequently, including the breath sound, okay, pag meron na ba or absent pa rin ba yung breath sound on the affected side, okay. Then the oxygen saturation, we monitor it closely, and respiratory effort. Then we monitor for tension pneumothorax, okay, we assess for worsening dyspnea, hypotension, jugular vein distension, and tracheal division, which is a late sign of your tension pneumothorax. Okay, that's all guys for pneumothorax. I hope you learned something. Thank you and God bless.